Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. It's that time of the year, the sun is shining, people are spending more time outdoors, which is great because doctors encourage exercise in children to prevent long-term health issues such as diabetes, heart disease, high blood pressure, and many others. But safety, especially with our children, needs to be a top priority. All too often, a trip across the monkey bars can become a trip to the ER. Well, joining us to discuss this common playground injury and how serious they can really be is Dr. Noel Henley, an orthopedic hand and arm surgeon. His specialty is stopping pain and restoring function for kids and adults with hand or arm problems. He was born in Fayetteville, Arkansas, and after training in Tennessee and Indiana for 10 years, has returned with his family to Northwest Arkansas, where he is a partner with 14 other surgeons at Ozark Orthopedics. Thanks for joining us, Dr. Henley. We appreciate it.
Thank you.
Tell us, what is the most common type of injuries that you see?
The most common type of injury I see from a playground environment is a fracture of the wrist or elbow in a small child. Usually happens when the child is climbing on a ladder or swinging on the monkey bars and they fall and they put their hand out to break their fall. And the most common elbow injury I see is a hyperextension injury of the elbow when the child lands like this and the elbow hyperextends and it breaks the humerus bone right around the elbow.
We have a picture of that. Let's take a look at that. And that's a normal elbow that we're about to see. Is that right?
The first image is a normal elbow x-ray, correct.
Okay.
And you see I'm pointing where the shoulder is there and now where the hand is. And in the middle is the elbow joint between the two forearm bones and the humerus bone.
Okay, and one of the most common injuries that you see is when it's hyperextended, and then what usually happens? Where is the break?
Right, so what I'm going to do is I'm going to highlight in red the area where I'm talking about. It's the distal part of the humerus bone right near the elbow joint, and that's the injury that we're going to be seeing.
Is that the most common area of injury that you usually see?
It's the most common elbow injury in kids that I see. And here you can see the outlined area is broken off of the end of the shaft of the bone and shifted to the side. So here I'm just going back and forth and showing you how the injury happens.
Now that has to be repaired in a timely manner, is that right?
It needs to be fixed relatively quickly in surgery, usually that night or the next morning. And you can see on the x-ray here where I put some pins across the fracture to hold it in place.
And is the purpose of that to restore blood flow and vascular supply and making sure the nerve function is intact?
Right. When the break happens, it stretches the nerve and blood vessel, and the shards of bone can even push through the muscle. And so putting those back in alignment helps all that heal. And it usually takes about 6 weeks for it to heal.
I see. And when you talk about a break, it's just it can be a quick snap. Is that right? It
just happens very quickly and happens in just a few seconds.
And these type of injuries can be prevented.
Right. So the general approach that I tell all the parents is to make sure you're supervising your kids. It's the top priority.
Sure.
Even if you can't rush forward and catch the child as he's falling, you're nearby. You can respond immediately. The other thing to look out for is dangers around the playground, broken pieces or large rocks or things kids could trip on. Another top priority is making sure that the kids around your child are playing safely and your child is playing safely. And so if there's someone who's doing something crazy on the playground equipment that they shouldn't be doing, you need to recognize that rapidly and stop it and figure out something else to do.
And just be aware of your surroundings.
Absolutely.
What about helmets, Dr. Henley? How do you feel about children wearing helmets?
Helmets are a tool that are available to parents to protect the child's head when they're doing things that are rambunctious or involve high speeds, like biking. And parents should take advantage of those. Protecting them from a brain injury is more important than protecting them from an elbow injury. And the elbow can be fixed pretty easily, though it involves a lot of stress. A brain injury is something totally different and definitely a devastating injury.
Absolutely. If a parent suspects an injury in their child, what type of signs should they look for?
Especially in the arm and the leg, you want to look for any kind of bleeding, swelling, deformity, bruising, especially in the case of a fall and a child is screaming and crying, it's also important to make sure they can respond to you. They're awake. And that's the most important thing.
Right. You know, I read a statistic as much as 1 out of every 5 visit to the ER has to do with a musculoskeletal injury, so it's definitely preventable. And what are some of the long-term consequences of a bone injury if something isn't done about it or if it isn't caught in a timely manner?
In the worst situations, the outcome can involve permanent deformity, permanent weakness, permanent stiffness, and dysfunction. The child's elbow doesn't bend or straighten in the right way, and that can be permanent if it's not recognized and fixed.
So early treatment and diagnosis is important, especially if it goes on for a day or 2 days or 3 days, because usually you tend to see an injury heal. If it's just a sprain, it would go away, but if it persists, the parent, that should alarm them to get their child checked out.
Right.
And what if there was no known injury? For example, if a child starts limping, what would you think about?
Right. The most common cause of limping would be just a minor injury, like a strain or a sprained ligament, or just some swelling in the joint that's temporary and goes away.
Okay. And what about, I know there's overweight young boys. There's a SCFE, slipped capital femoral epiphysis. Is that just if you're overweight, you tend to see that sort of injury, and does that require surgery?
It's a pretty unusual cause for limping in usually overweight boys. And it's something that you need to make sure is not going on if you have a child with a limp that's been going on for a while. And it does require surgery to fix it.
Okay, and what about a disorder, I believe it's rare, leg calf Perthes disease? Do you see that often in young children, or is it still rare, pretty rare?
Right, it's pretty unusual to see, but Perthes disease is a problem with the blood supply to the hip. And if that's not recognized pretty quickly, then it can lead to arthritis and problems with the hip in the future.
I see. How important is diet in young children, vitamin D consumption and prevention of rickets, that sort of thing, Dr. Henley?
Vitamin D and calcium intake, or eating enough dairy, vitamin D and calcium is important for young kids especially. Getting enough sun exposure is also important because sunlight is involved in the process of making vitamin D. And so one of the common questions I get from parents when their child has had several fractures is my kid's bone normal? Well, chances are it's normal, but if your child has multiple fractures just from them tripping or falling from a standing height, then you may want to make sure that they're getting enough dairy.
Okay. And as far as safety tips for children, how do you feel about elbow pads and knee pads, whether you're skating or running or biking? Do you recommend that for all young children, just to help prevent those preventable injuries?
I do. I think the protective equipment is pretty important for young kids, especially when they're starting to learn some new kind of sport that could involve high speeds or a loss of control or frequent falling, something like that. So elbow pads can help prevent fractures and prevent bad skin injuries, those kinds of things.
And if someone does unfortunately injure themselves and they end up having surgery, what's the process like if someone, a child breaks their elbow, like the x-rays that you showed us earlier?
Sure.
What is the process going to be for that child?
So the family brings the child to the ER, and then I would see them in the emergency room, one of the orthopedic surgeons, and we'd decide with the parents to have surgery. That's the best thing, and then later that night or the next morning, take them into the operating room. They go to sleep, and they have the surgery, put the pins in or whatever we do. And then afterwards, usually I either, if the kid is very comfortable and everything's going well, they can go home. Otherwise, if they're in some pain, then they might need to stay overnight.
Okay. And will they go home and then start a physical therapy program, or do they just get casted for a couple of weeks and follow up?
Good question. So after an elbow fracture like that, the child is in a cast for about 5 or 6 weeks. And usually I have them come back to the office to check x-rays, sometimes every week, to make sure that fracture doesn't slip or move, and make sure it's staying in the same position and healing well.
Very good. And what is your top summer safety tip for us today?
A top tip for parents is to make sure they are involved, that they are supervising their kids, that they, that parents know their kids best. And so whether it's something rambunctious and crazy or just something in the backyard, you need to make sure that the activity is matched up well with your kid's experience level and their knowledge of the rules of the game, so to speak.
Very good. And for our viewers watching at home, where can they go to get some more information? I understand you have some websites for us, is that right?
I do. The They can find some good tips on preventing warm weather injuries at our website, at our clinic,
Okay.
ozarkorthopedic.com/prevention.
All right.
Another article about common questions I get about fractures from parents is at my website, which is noelhenley.com, and they can find that article at the top of the website.
Very good. Well, Dr. Henley, thank you so much for joining us today. We appreciate it.
Thanks a lot.
All right. Stay tuned. Family Health Today will return in just a moment.